So my name is Julie Hereford. I am a family nurse practitioner with a dermatology nurse practitioner certification. That dermatology nurse practitioner certification is something that is not super common. I think there's about 14 of us in the state of Oregon. There's 14 or 16 in the state of Washington. It's something that is really important to help kind of just promote that dermatology field in the nurse practitioner community. Being a dermatology certified nurse practitioner means I've had some extra training beyond my original nurse practitioner school to help with that dermatology specialty. Today, we are going to talk about sun protection and skin cancer prevention. So the first thing I want to talk about is what is it that we're really trying to prevent, or why should I be using a sunscreen? So there are more people diagnosed with skin cancer in the U.S. every year than all other cancers combined. So this is breast cancer, prostate cancer, colon cancer. All of these don't even hold a candle to how many cases of skin cancer are diagnosed every year. There's multiple different types of skin cancers. Some of them are more common, some of them are more rare. And we're going to kind of go through and talk about some of these different presentations of skin cancer that we see. First one is actinic keratoses. These are precancerous lesions. More than 58 million Americans are diagnosed with actinic keratosis every year. These are the red, scaly, kind of white, plaquey areas on the skin that come up, and sometimes you can kind of pick them off, but then they always come back in the same area. These are ones that if we don't treat them, they can progress to squamous cell carcinoma, which we don't want, and we're going to talk about that later. So what we do to prevent these or to treat these is liquid nitrogen cryotherapy. There's some topical medications you can use. There's some light treatments that you can use. You can scrape them off with a curette. Multiple different ways to treat these, but they are important to treat so that they don't get ignored and turn into something that's a bigger deal. Basal cell carcinoma is the most common form of skin cancer. There's about 3.6 million cases of basal cell carcinoma diagnosed in the U.S. every year. This and many of these others come from a lifetime of chronic UV exposure. So it's not one day in the sun. It's not the one sunburn that you got. It's that day after day chronic life in the sun. Basal cell carcinoma, we say that if you want a skin cancer, if you're going to have a skin cancer, if you're going to have any cancer at all, this is what you want, because it makes a sore on the skin. It can be locally destructive, locally invasive, but it doesn't metastasize. You don't end up with basal cell carcinoma in your brain or your lungs or your colons. It just stays where it is. It can be locally invasive down to the bone if we don't treat it. So it is important to treat it and not ignore it. The way we treat these surgical procedures, you can do radiation, there's some topical injections, and then this targeted therapy are either pills or IV injections that help shrink the basal cell carcinoma. A lot of the times we do that just so that it's more easier to treat surgically, so it's not so large, because these can get really big. Second most common form of skin cancer is squamous cell carcinoma. These are the ones that little actinic precancerous things can turn into. Again, caused from a lifetime under the sun. These ones can metastasize. So these can spread, these can end up in your brain or your liver or your colon. These are ones that we, again, treat with surgical procedures, radiation, immunotherapy treatments to shrink them down. And these, there's about 1.8 million cases in the U.S. annually. Most of the squamous cell carcinomas are caused from the chronic sun exposure, but there's other things that can cause them too, specifically HPV infections and something lichen sclerosis, which is a itchy sort of condition that people get in their genitals. And so this is where a lot of these external genital cancers come from. It's either HPV or just this lichen sclerosis, where you just have this big scratch. It disrupts the skin and prompts these squamous cell carcinomas to come up. The other place that squamous cell carcinoma will come up is in burns. So either chemical burns or thermal burns. So people who have a burn history need to be really cautious about watching those burn scars to make sure there's no new lesions coming up in them. The next one, atypical or dysplastic moles. These aren't really a skin cancer, but if you have more than 10 atypical moles, it increases your melanoma risk 12 times. So these are the ones that we tell you to watch for, the ABCDEs. So something that's symmetrical, has an irregular border, something that has multiple colors, has a diameter bigger than a pencil eraser, or something that's evolving over time. So it started out as a little dot, and now it's the size of a pencil eraser. We want to watch these. The other thing that they don't say in this ABCD mnemonic is F. And this is the one that's the funny looking one. So, you know, I have 50 moles, but that one looks different. And those are the ones that we want to watch for. So, you know, some people make moles that look funny. And if you have 80 funny moles, they're probably all okay. But if you have 80 normal moles and one that looks funny, that one needs to be checked out. Well, the big hitters, melanoma. Melanoma is more common in men than women. It is on men, they'll get it on their backs. On women, they'll get it on the back of their legs. So if you think about men, you know, they'll take their shirts off. Women don't really do that, but will wear shorts or skirts, and you turn your back to the sun so that you're not having the sun in your eyes. So you'll get that posterior exposure more than you do on the front. With melanoma, early detection equals better survival. So these are the ones that when you see these moles, we want to be sure that we're taking care of them. These are treated with excision and pretty much only excision. We do something called a wide local excision where we take a nice big margin around the mole so that we get all of it. A lot of skin cancers will grow like a baby where you get bigger and bigger and bigger. Melanoma will actually have satellite lesions that come up from the outside and will pop up, you know, away from the original mole. So this is why these get a little bit wider excision. Those aren't the only skin cancers out there, though. There's these other scary things. This top one is called a keratoacanthoma, and these ones are ones that we see a lot. Before I came over here, I took one of these off. These are, people will think that they're a pimple. They see that and there's that little hard core in there. And they say, I can't pop this thing. It won't come out. And they're just hard as a rock. These are kind of a relative to squamous cell carcinoma. This next one down here is a Merkel cell carcinoma. Merkel cell is actually the deadliest of all of these, more deadly than melanoma. There's about 3,000 cases in the US per year. 40% of people who have a Merkel cell carcinoma will get a recurrence. It has about a 30 to 40% mortality rate. So about 30-40% of people who get Merkel cell carcinoma will die from it. In comparison, melanoma, just in general, has about a 99% survival rate. Worse if they're more invasive melanomas. A stage 4 melanoma is about a 65% mortality. So those invasive ones are more, will be a bigger mortality than Merkel cell, but Merkel cell in general has a higher mortality. These other ones, atypical fibroxanthoma, dermatofibroma sarcoma protuberans, which always makes me feel really smart when I say that. Extramammary Paget's disease. So these will show up. Paget's disease is usually a breast cancer, but you can get it other places. The common place is kind of the groin for men. So these are the ones where you get the jock itch that never goes away. They use ointments and creams and nothing ever gets better. And then sebaceous carcinoma is the one up on the nose. Sebaceous carcinoma is actually the one down here up on the side. All of these have a sun exposure association. So when you have something on your skin that's not going away, when in doubt, check it out. Either with your primary or your nurse practitioner or your dermatologist. So 1 in 5 Americans will develop a skin cancer by the age of 70. Having 5 or more sunburns doubles that risk for melanoma. More than 2 people die from skin cancer in the US every hour. And we talked about this already. When detected early, the 5-year survival rate for melanoma is about 99%. So prevention, the biggest thing is just don't be in the sun. Seek the shade, especially between those hours of 10 and 4 when that UV index is the highest. UV index is something you can find it on your phone, you can find it on your watch, and it gives you a number of how much UV radiation is in the atmosphere. It's a linear scale, so it starts at 0 and it doesn't top out. So 0 is dark, 10 is considered midday summer sun in a tropical location. A 20 is equator areas. And I was kind of going over this with my son last night. He was helping me out. And he says, well, what's the highest UV index ever? Go to Google. 43.3. A UV index of 43.3 was recorded in Belize on the top of some volcano in 2019. So UV index will be if you burn in 30 minutes at a UV index of 5, you'll burn in 15 minutes at a UV index of 10. So you can kind of stretch that math out to know what it kind of means. Avoid tanning beds. Don't purposefully tan. 1 blistering sunburn will double your lifetime risk for melanoma. Tanning causes that genetic damage to the skin, and it starts with the first tan, and it is cumulative through the lifespan. Tanning ages the skin, makes more wrinkles, makes dark spots, texture changes, and then if you develop a skin cancer, then you're going to have scars. So we want to avoid all of that. So cover up. This is maybe a little extreme. We go from magnet, but use those sun protective clothing, wide brim hat, UV blocking sunglasses. UPF clothing is an interesting thing. UPF and SPF. So clothing has a UPF, and typically things are UPF 50. So what that means is that 1/50th, or about 2% of UV will penetrate that fabric. The things that, the ones that you get from Columbia or Cooley Bar or some of these others that have that UPF rating, most of it's going to be UPF 50. If you're just looking at your normal standard clothing, you want to choose a dense weave over a sheer fabric. You want to choose a dark color over a light color, and you want to choose loose fitting over tight fitting. And you can actually hold your clothing up to the light and see how much light comes through it. And that's going to be relative to how much UV is going to penetrate too. So a white t-shirt, just your standard white Hanes t-shirt, is going to have a UPF of about 7. So that's going to block about 14% of that, the penetration. If that shirt gets wet, that UPF goes down to about 3. So other things, the big thing with this is sunscreen. So you want to find something that's UVA, UVB, broad spectrum sunscreen with at least an SPF of 30 for everyday use. If you're going to be outside in any kind of outdoor activity, you want to increase that to an SPF 50. The reason for using that sunscreen daily is there's 2 different types of UV. There's UVA, which is the UV that ages you, and UVB, which is the UV that burns you. So even without having a sunburn, those UV rays, which can penetrate window glass, will increase that risk for aging and skin cancers and wrinkling and all of those things. The broad spectrum sunscreen, which anything sold in the US right now is going to be broad spectrum. And it really doesn't matter what vehicle it is, whether it's a spray or a cream or a lotion or a stick or a powder. just use it. Find one you like and use it. And we're going to talk a little bit more about that in a minute. So the SPF is a really interesting thing to really look into because it's really misunderstood. So people will say, if I use an SPF 15, that means I can stay in the sun 15 times longer than what I could without it. And that's really a misconception. That really isn't what it is. So what SPF really is how much UV radiation is required to produce a sunburn on protective skin relative to the amount of UV that's required to produce a burn on unprotected skin. So SPF 15, so with no sunscreen, say there's 100 photons of UV radiation out in the environment. If you have no sunscreen, all of those 100 photons are going to make it into your skin. If you use an SPF 15, it's going to require 15 times more radiation to penetrate into the skin. So with an SPF 15, you're going to get about 93% of those UV rays blocked. So if you take 100 and divide it by 15, you get 7. So that's what's getting into the skin. You bump it up to a 30, and there's really, or a 50, and there's not really that much. Oh, this was, no, a 15 to a 30. There's not really that much relative increase in risk. So that's why people will say that those higher sunscreen numbers don't really mean a lot. As long as you have that 30 to 50, you're probably fairly well protected with some exceptions. So this kind of talks to that decrease or the increase in sun protective factor versus UV absorption. One of the other important things to think about is when you reapply your sunscreen, it doesn't reset the clock. So if you have been out in the sun for an hour and your sunscreen has blocked 98% of the photons that come in, you've still got those photons. The putting the sunscreen on again doesn't erase it. So if it takes you, these are all just random numbers. If it takes you 15 photons of radiation to your skin to burn, you're going to keep accumulating that. So that's why people say, well, I put on sunscreen all day long and I still got burned. It's because that cumulative sun exposure happened and you're having that continued radiation exposure. How much sunscreen? Nobody uses enough. The amount of sunscreen that you should be using to protect your whole body is about the size of a marshmallow, about 2 ounces, about 2 tablespoons. 2 tablespoons is about 1 ounce. A standard bottle of sunscreen lotion has 8 ounces in it. So if you are having a standard bottle of sunscreen lotion, it has 8 applications, not 2 summers. So really nobody applies enough. And the reason why I said we talk about the vehicle you use later, with lotion, I kind of like the lotions better because you get that tactile. It's in my hand and I can see how much sunscreen I'm putting on. Where if you use the spray, you're and half of it's going to the floor of the dog and the wherever else. So you don't really know how much of that sunscreen you're getting on your skin. Julie, I've heard that sunscreen causes cancer. Why would I want to use it? So there are 2 sunscreen ingredients that they call, it's called GRACE, generally regarded as safe and effective. And these GRACE sunscreens are those ones down at the bottom, titanium dioxide and zinc oxide. And these aren't really sunscreens, these are sunblocks. So what they're doing is they sit on top of the skin and they reflect the rays back off of you. The sunscreens are absorbed into the skin and help absorb the UV photons so that they don't damage the skin. There are 2 of those sunscreens that have been banned by the FDA. Those are the ones at the top in red. You can't find those in sunscreens in the US anymore. Those other ones are still found in sunscreens. And the reason why this whole thing came out about sunscreens being unsafe is because in 2019, avobenzone, which is that first one at top, They did a study on it and they applied it to someone in a maximal recommended use. And then they checked and the avobenzone was detectable in the bloodstream. They repeated that study a year later, and all 6 of those ingredients that have the star by them, they tested, and all 6 of them were detected in the bloodstream with 1 application. Absorption doesn't mean risk. So just because those chemicals are found in the bloodstream, it doesn't mean we don't know what the significance of that is. They're still looking into it, but we know that UV exposure causes skin cancer. We know you should protect, and we know that nobody is good at protecting otherwise. So continue to use your sunscreens along with those other sun protective measures. If you're worried, choose those 2 that are the sun blocks that have that GRACE designation. So that's the titanium dioxide and zinc oxide. Babies have less melanin in their skin, so they have increased sun sensitivity. We really don't want to use any kind of a topical sunscreen on them until 6 months of age. So we want to do sun protective clothing, keep them out of the sun, and then at 6 months of age, you can choose those sun blocks. Again, that's zinc oxide and titanium dioxide. Don't burn your minds.